Right. Good afternoon, everybody. Cameras all set? All right. First and foremost, let me start with the obvious. Thank you. Thanks to all of you for being here. Thanks for the wonderful staff and advocates who put this together. Thank you for the advocates who are standing behind me and, more importantly, in support of mental health and of appropriately funding mental health. Also, thank you to my colleague, Representative Justin Fleming, for being here. I will start by confessing a little bit more frustration than I think I wanted to have at this point in the budget issue, especially considering what we're talking about, because we're talking about mental health. There are a few issues that bring people together in public policy these days as much as mental health. I can guarantee that there isn't an elected official who works in this building who hasn't heard it before. The patient who knows that they are getting more depressed but can't find a therapist. The desperate parent who's trying to get help for their suicidal child but can't find a hospital bed. The police officer who knows that they are dealing with an individual having a schizophrenic episode, but doesn't have the tools to help manage that individual. Last year, in a bipartisan fashion, the Senate and the House overwhelmingly approved a budget that allocated $100 million in federal funding to adult-based mental health. That money would be spent in accordance with a report submitted by the Behavioral Health Commission, a nonpartisan group of mental health experts who would seek the way to best allocate that $100 million. In this year's budget, the Senate went back on their word. Simply put, they redirected money that had been budgeted for adult-based mental health and shifted it to school-based mental health. This left patients, healthcare heroes, and law enforcement officers behind. Fortunately, there is still time to correct this egregious error, and we need to make sure the Senate does just that as the budget conversation continues. So, by way of background, this $100 million report basically allocated money into three separate sections. It put about $34 million to workforce recruitment and retention, $31.5 million for public safety, and $34.5 million for service expansion. Now, in June, after negotiations with House Republicans, House Bill 849 passed. That was my legislation that approved this $100 million investment with some changes that were negotiated by my House Republican colleagues. It passed with a massive bipartisan vote, 173 to 30. 71 of 101 House Republicans, including Human Services Chairman Doyle Heffley and every member of Republican House leadership, joined every single House Democrat in voting yes on this investment. So let me be clear, I am mentioning my House Republican colleagues to note that there are some issues that can really have a bipartisan vote. And let me reiterate, the need for this investment was so apparent that 70% of House Republicans, not exactly known for their progressive liberal ideology, voted to spend $100 million towards adult-based mental health. Candidly, I am extremely grateful for their support. We negotiated in good faith, and it was reflected in the vote count. We sent House Bill 849 to the Senate for the hopes of continued negotiation and the inclusion of 849 in the final budget. So imagine my surprise in late June when the Senate sent us their budget. House Bill 849 was supposed to take $100 million in money from the American Rescue Plan. The Senate not only didn't do this, but they took that $100 million and instead spent it on school-based mental health that was originally going to be funded based on recurring revenues in the budget and as had happened last year. So let's review. The Senate zeroed out adult-based mental health and instead funded school-based mental health. Now, let's be clear about something. Contrary to what the Senate would have you believe, this is not an either-or proposition. We need to fund both. In fact, the budget passed by House Democrats in late June did just that. The Senate is trying to have their cake and eat it too. They voted to encumber the money last year, meaning set it aside for future investment, but then not actually spend the money this year when the rubber meets the road. So why did the Senate make such a strange choice and leave the mentally ill in the dust? I can't say. They haven't given us any indication about how they want to proceed going forward, particularly when it comes to mental health. So where do we stand? I have to be an optimist. And I do still believe that there's an opportunity to negotiate and get this done. The Senate has noted that without budget implementation language, commonly referred to as code bills, the budget process is incomplete. They're correct. But as House Democrats have made clear throughout this budget process, we are not an afterthought. We are the majority of the House of Representatives. More to the point, an overwhelming number of members of the House of Representatives, including 70% of Republicans and every single House Democrat, voted to make this investment. We believe that mental health and caring for the mentally ill is one of the most important and timely things that government can do today. If mental health had somehow shown vast improvements over the past year, perhaps the Senate decision not to fund these mental health initiatives would have made more sense. But does anyone really want to look me in the eye and tell me that there are more practitioners in the field? That waiting lists are growing shorter, not longer? That police and corrections officers don't need more training and resources to protect the communities they serve and to protect themselves? The Senate failed Pennsylvania, but there's still time to make this right. I am thrilled to be joined by advocates, by other elected officials, and passionate individuals in this field to call on the Senate to ensure that they pass this $100 million investment in the budget that is still to come. House Democrats are committed to working with them to ensure that we create a budget that reflects the needs of Pennsylvanians across a variety of public policy areas, including and especially mental health. And with that, I'm going to take a moment to turn it over to some of the experts. First, we're going to hear from Dr. James James, Chair of the Department of Psychiatry and Behavioral Health and Division of Addiction and Recovery. Your title's longer than mine. And Division and Recovery at St. Luke's University Health Network. Dr. James.
Thank you all. It is estimated that more than 1.5 million Pennsylvanians suffer from a mental health condition each year. Before COVID, we were stretched thin, but we felt like we were making progress in reaching out and helping people that needed it. It's not true anymore. Estimations suggest that 500,000 Pennsylvanians or more are going every year without any access to mental health services that they need. The Pennsylvania shortage on behavioral health professionals is profound. 53 of Pennsylvania's 67 counties are designated as full or partial mental health professional shortage areas. Delays in behavioral health care can be devastating to patients, and usually by extension, their families. Without timely, consistent, and appropriate interventions, symptoms too often present in a way that leads to full-blown crisis. What then we deal with is people having fallout in their lives and substantial devastation in their ability to function. These individuals then have a challenging road back to wellness, mental wellness, social wellness, and physical or financial health, as well as being engaged in society effectively. The Commonwealth can and must do better. St. Luke's is deeply committed to caring for people with behavioral health needs in our communities. We employ more than 1,000 behavioral health professionals, and over the last 5 years, we've had a number of accomplishments. This includes opening a walk-in crisis center, increasing behavioral health inpatient beds from 56 to nearly 200, adding an adult and adolescent partial hospitalization program, opening 4 additional behavioral health outpatient locations, adding integrated psychotherapists to 30 primary care practices, establishing 2 psychiatry residency training programs, opening both inpatient and outpatient substance use disorder services, and contracting to provide behavioral health services to 64 local schools and counting. It sounds like a lot, right? It is, and I'm very proud of the work and being a part of St. Luke's. But here's what I can tell you. Not every community has a St. Luke's-like resource. And it's particularly true of many rural areas. And perhaps what's even more disheartening is that despite all of this hard work, our wait lists for behavioral health continue to grow, as do the heartbreaking visits to emergency departments by people in crisis. Hospital emergency departments are overwhelmed by the demand for mental health needs. And while I highly commend our emergency care colleagues for all the great work they do, they are not a stand-in for mental health services. They need help. And they need to be able to get these individuals into the right levels of care in a timely fashion. And if these individuals need behavioral health services in an inpatient setting, we need to be able to get those individuals back to their lives in a timely fashion once they're stabilized. I'm not exaggerating when I say that patients facing mental illness can wait for weeks in emergency rooms waiting for a bed. Or people that are on our floors already can wait months before they get the right resources to be able to be discharged. This is not an adults versus children or hospitals versus community-based care. This is not urban versus rural or, frankly, Democrat versus Republican. This is a Pennsylvania issue. And Pennsylvania must invest into the entire continuum of behavioral health care. I hear too often from my patients, resources are slim, they can't afford the medications or the treatment that they're seeking, that the programs that they need are either backlogged underfunded, or don't exist. Despite extending great personal effort themselves to seek help, they're not finding the help they need. They work very hard to help themselves. I can tell you of countless stories of motivation, hard work, and determination exhibited by many people that I've worked with. And under other circumstances, that would have led them to a path of success. But when there's a lack of resources, tools, and supports, the human spark is often robbed of the fuel it needs to light the fire of achievement. The General Assembly, through mechanisms like House Bill 849, which makes investments to stabilize the workforce and increase the capacity of community services, can bring hope to hope and opportunities to countless Pennsylvanians. I ask the state policymakers to ensure that behavioral health patients can connect with the fuel that they need to fight the darkness. You can help light shine. When you do, you illuminate the path forward that allows every Pennsylvanian to contribute their unique and authentic selves to our communities. I thank you, and I turn over to Sierra McNeil, MSW, Adult Behavioral Health Services.
Good afternoon. My name is Sierra McNeil, and I wear many hats and have many roles. But today I'm speaking to you as a private citizen and a social worker that has worked with families and their loved ones and the behavioral health system for the entirety of my career. Myself and those in search of behavioral health services and their families are exhausted because we have been talking about the mental health crisis for years, well before the pandemic, and yet here we are today having the exact conversation with little hope that things will get better. As a social worker that works in adult behavioral health, I know how critical this much needed and overdue funding is to reach the workers. But most importantly, it's needed to strengthen and create access to behavioral health services to all Pennsylvanians. I have worked in the behavioral health system for many years. However, I spent the last 3.5 years working directly with family members in adult behavioral health system. Most days, my phone would ring as early as 7 a.m. and as late as 10 p.m. because we know that crises do not operate on a 9-to-5 schedule. With calls from family members who are exhausted, frustrated, feeling hopeless, because they could not find the help that they are needed. Exhausted from calling upwards of 20 different providers looking for services for their loved ones, or in some cases themselves. Because let's not forget, when a family member has a loved one in crisis, they are too experiencing their own version or own level of crisis. Frustrated, and this is a direct quote from a family that I spent 6 months with trying to get them services. And she stated, "I feel like I'm fighting against a system that is supposed to help me and my family." Imagine being in your most vulnerable time of your life and there's no one to help, only to say, "I can add you to a waiting list that is 6 months or longer." The feeling of hopelessness is the hardest on families when they have exhausted all avenues and they still don't have the services that they desperately need. And so I think it's about time that we start putting our money where our mouth is. If you say you care about mental health, fund us. If you say that all Pennsylvanians deserve access to behavioral health services, fund us. If you say you care about behavioral health workers, fund us. And most importantly, if you say that you value the life of each and every Pennsylvanian, fund us. We have to stop thinking that these challenges that we are witnessing are not connected. We are in a never-ending cycle of providers being under-resourced, which means our workers are under-resourced, which then has a direct impact on our communities being under-resourced. So let's be clear, this mental health crisis that we are experiencing was not created by individuals and their families. It is a crisis that was created by an underfunded system. And if we don't begin to understand that, any solutions that we create are going to be Band-Aids to a bleeding wound. The Commonwealth of Pennsylvania has a duty to respond to the crisis experienced by their citizens. The $100 million is the first step to addressing the mental health crisis from a systems perspective. It will put $34 million towards workforce development and retention programs, $31.5 million to expand criminal justice and public safety programs, $34.5 million to ensure the stability and expansion of mental health services and supports, This bipartisan supported funding will go back into the federal government if these funds are not signed into law by December 31st, 2024. There's this saying from when I was working with families that I enjoy, and I would love to share it with all of you: nothing about us without us. And while I say to all the families of Pennsylvania, reach out to your representatives and share your stories. We have to let our government know that on the other side of this conversation is a son, a daughter, a mother, a father, but most importantly, there is a life worth saving. Thank you. And I would like to hand it over to Kate Fetzer, who's a peer leader from NAMI Lehigh Valley.
Thank you very much for the introduction. Suppose I am the voice of the life worth saving, if you will. 20 years ago, I was diagnosed with a serious and persistent mental illness, mental health diagnosis. Hearing the words bipolar disorder 1 was one of the most devastating moments that I've had. Changed my life. At that point, I did not feel it was going to be for the better in any way. For the following 10 years, through the support of family, friends, and a team of providers, I was able to get to a place where I was experiencing wellness and was productive and was having healthy relationships and was really proud of the distance I had traveled until my psychiatrist left the practice that I was attending, which is a great practice. This is not a commentary on healthcare professionals. Everyone cares and everyone tries. But I was told that there were no other providers, no appointments. Just, sorry, we can't help you. And for a patient who relies heavily on medication for wellness, there was no one to prescribe that medication. So this resulted in worsening of the symptoms to the point where I ended up hospitalized. And it could have been a simple intervention. What are we hearing, though? There are a lack of providers, and they're doing the best they can. So then it took 10 more years. That was an additional trauma, right back to a journey to wellness again when I was already well. It was a disruption of the lives of my family. I missed work. It just turned my whole life upside down again. Another trauma in a series. What could have prevented this? More providers. Adults who are suffering with mental health symptoms may only have the energy, the wherewithal, for one moment to make one phone call. Somebody needs to pick up the phone, and there needs to be an appointment and a provider available when that happens. I'm an adult. My mom can't call for me, right? I need to do that myself. So, I don't have anybody who can make an appointment on my behalf. I'm over 18. Again, the second phone call, the third phone call may not ever happen. I'm fortunate. I found the help that I needed. Today, I live what I consider to be an amazing life. Wife, mother, full-time employee in a career that I love. I do work for NAMI Lehigh Valley, giving back as much as I can as a peer support person. I facilitate and do education programs. It's the least I could do, considering all of the folks that have helped me over the years. But just, to echo what everyone has said so far, without providers, how do you get well? Where do you start? What do? You become the statistic of 1 in 5 Pennsylvanians, or maybe even 5 that we lose every day. And that's not okay. So we need the funding. Thank you for your time.
Thank you very much. Thank you to all the speakers. Also pleased to be joined by Representative Joe Webster of Montgomery County, who made the trip out here today. And concluding the press conference is going to be Senator Maria Collette, who, like me, served on the Behavioral Health Commission and was very familiar with that process and how we got here. So, Senator.
Thank you so much, Representative Schlossberg. And hello, everyone. I'm Maria Collette, and I have the privilege of representing parts of Montgomery County in Pennsylvania's 12th Senatorial District. And I'm also a nurse, formerly of St. Luke's, Dr. James, and a very dedicated mental health advocate. All of us have people in our lives who have dealt with or are still dealing with the impacts of mental health concerns. Whether these experiences are rooted in trauma, genetics, or both, we know that the number of adults with mental illness has increased in recent years, particularly in the wake of the pandemic, with nearly 34% of Pennsylvanians struggling with mental illness or substance use disorder. As a nurse, I know firsthand how gaps in mental health care treatment can harm patients, their families, and the healthcare professionals who are doing their best with limited resources. We cannot afford to leave our brothers and sisters, our mothers and fathers, our children, our friends, and our neighbors behind to tackle their challenges alone. That's why expanding mental health services has been a top priority for me. Why I was so honored to be appointed to the Behavioral Health Commission on Adult Mental Health, and why I am so frustrated that the Senate Republicans have failed to take up any vote to distribute this funding. The Behavioral Health Commission was comprised of experts in various fields ranging from the criminal justice system to treatment professionals, state agencies, and Pennsylvanians with lived experiences. We met for more than 17 hours deliberating how to most effectively allocate the $100 million in federal ARPA funds for adult behavioral health programs and workforce development. Ultimately, we developed recommendations that were reflective of what the advocates and experts requested. To release the funding, Representative Schlossberg and I introduced legislation that closely mirrored the Commission's recommendations. Despite the desperate need for mental health funding in our Commonwealth, my Republican colleagues in the Senate have refused to call up our legislation to release these vital funds. And now, adding insult to injury, when presented with the opportunity to get this done in this year's state budget, they chose to redirect that $100 million to school-based mental health instead of the adult mental health programs the Commission painstakingly identified. To have the hard work and recommendations of this Commission cast aside is nothing short of devastating for the many patients, loved ones, and organizations who were eagerly awaiting the help promised by this modest influx of funding. And please don't get me wrong. I firmly believe both adult mental health and school-based mental health must be better funded. And with a record surplus sitting in reserves, there is no good reason funding for these initiatives must be an either-or proposition. The lives of our families, our friends, and our neighbors throughout Pennsylvania are on the line. We need to push this funding out to the people who need it. Rest assured, I'm committed to that fight. Representative Schlossberg, our colleagues here today, we are all committed to that fight. But we cannot do it alone. Your state representatives and state senators need to hear from you. Call, email, write their offices. Let them know why funding for adult behavioral health is so important to you, your family, your community. Your voices and your stories matter. Thank you to each participant here today. Thank you to our advocates in the community. It's time that Harrisburg deliver for these patients and providers and put our Commonwealth on a path to truly making the lives of all Pennsylvanians better. So I am excited to be here with all of you today to make that plea, to get this funding out the door, to make that vision a reality here in our Commonwealth. Thank you.
And thank you, Senator. And the Senator and I are happy to answer any questions. Dennis.
Senator, what role, if any, did Governor Shapiro have in this? As I understand it, you're saying that the money was supposed to go to adults. They moved it during the budget negotiation to school, mental health counselors. And from my understanding, the governor was ready to sign off on that budget.
Governor,
what role
absolutely.
does he have, and was he involved in that negotiation? And have you talked to him about this?
We've had conversations with the governor about both packages. Now, to be clear, he's been really, really supportive of mental health, broadly speaking. He supported House Bill 849 and Senator Colette's companion bill, whatever got over the finish line first. He supported continuing former Governor Wolf's $100 million budget allocation. He also proposed increasing county funding by about $20 million, as well as a regular revenue stream for 988 for the crisis lines. These were all mental health initiatives that he supported. He was absolutely ready to sign House Bill 849 if it made it to his desk, and he supported the $100 million in his budget. He was willing to do both. We are willing to do both. The House voted on doing both. Senate Democrats are ready to do both. We need the Senate Republicans on board to get this to his desk.
You mentioned the code bills. If the House and the Senate can't agree to where this money goes in the code bills or in the language that directs it, will that money then go unused by either of these programs?
So what Senate Republicans did was they actually took the federal funding, the ARPA funding, and they put it towards youth-based mental health. So the money will go out. Now, we are running, I believe, at least a $1.1 billion surplus. I think what we would like to see is some of that funding go towards this adult-based mental health. I think given where we're at right now, I'd like to see what basically comes down to a reversal. Because if things had worked out the way they should have, you would have had one-time funding go towards adult-based mental health and regular recurring budget expenditures go to school-based mental health. We now are at the point where one-time funding is going towards school-based mental health. Fine, so just spend recurring money towards adult-based mental health. I have to be honest, I almost don't care which pot the money comes from. It's irrelevant. I don't care if it's my bill, Senator Colette's bill. I don't care if the money literally involves Senator Pittman going like this on the Senate floor. I just want the money out the door. People need it. They were promised this funding. They deserve it. Sean.
How much money was the school mental health allocated without the American Rescue Plan money? Like,
$100 million. So it's actually the same amount of money. Yeah.
So is it getting double funded, or it's just
No, it's just once funded once. Yeah.
And then with House Bill 849, that would have allocated the money and wouldn't have to go through the budget process?
Correct.
Okay.
Correct.
So is it possible, since the House passed that the Senate could then just pass that separately?
Absolutely.
So that's one avenue.
Yep.
But I just want to go back to follow up. So you're saying the Senate changed things around.
Mm-hmm.
Was Governor Shapiro okay with the way they changed things around? Because it appears there was a negotiation between him and them, and that he was ready to sign the bill.
I am inclined to say no based on his previous support. I know he did say that there were aspects of the budget he supported, but he also said there were aspects of the budget that he didn't support. He had said previously that he supported 849, so I can't really speak for him. I can just tell you he did tell us, and he said it publicly as well, that he wanted to see this money go out the door. 849, the $100 million for adult mental health and youth mental health.
But did you reach out to him specifically about this problem?
We haven't spoken with him about this one yet, no. It was obviously a little bit of a different budget process this year. Anybody else? Thank you all very much for being here. More importantly, thanks to all of you. We sincerely appreciate it. Thank you, folks.
Okay.